Hello, everybody. Dr. D here, back into the land of the living. I've been down for a few weeks. Been posting here and there. Haven't done many videos. Been sharing with you guys um, that I've been going through a depressive episode, but it's okay. I'm back. Got my new haircut. Told y'all when I cut my hair, I'm about to do something epic. Got on my cert gear, living life unapologetically. Okay. That's a tongue twister. Listen, I wanted to share real quick with you guys the kind of looking side by side at depression versus anxiety. I had a client today that asked me about that. I oftentimes get that question, but it just sparked something in my head today that if this person had the question, and someone else might have it as well. And so, both anxiety and depression are both mood disorders. And so they affect people emotionally, but it also affects them physically. And so depression looks something like, and I took my little notes here because I want to be as brief as possible, respect you guys' time. Depressed mood, lack of interest or enjoying things that you normally would enjoy, changes in your appetite, either up or down. If you don't, if you normally eat like a certain amount of food, and then all of a sudden you feel like you're not hungry at all, you know you need to eat and you haven't eaten, but you don't have a desire to eat. Or you normally eat a certain amount of food, but then you just see yourself constantly eating and eating and eating. There's a lot of guilty feelings associated during this period of time, hopelessness. There can be thoughts or ideations related to suicide. Not necessarily that the person wants to take their life, but just kind of thinking a lot about not wanting to be here. The person can be much more, have much more fatigue, be much more lethargic, meaning tired than they normally would. And that can go on in a major depressive episode, which is kind of like what I was experiencing for the past few weeks, for a period of about 2 weeks or more. And so that's more of a depressive episode. During seasonal affective time, people can experience that. Much longer. Thankfully, this year I didn't experience it as long as I have in the past, because I've just learned over time just different things that I need to do, but it still comes. So then let's talk about. Also, I forgot, trouble concentrating is a really another big one. Okay, so let's go to generalized anxiety. And so, generalized anxiety, although there's different types of anxiety, but generalized anxiety is kind of a worry, an excessive worry about everything. In children, it can look a lot like worrying about performance at school, performing really well at school, and then performance with friends, interacting with friends. In adults, their chief complaint has to do with things like finances and relationships, but real big on like finances. But other things, just like, a person could be worried about getting to work on time and they work 5 minutes away, yet they left the home an hour ahead of time. There's also the symptoms of restlessness. And so, restlessness, like for me, looks like when I'm in sessions with patients, my legs shake a lot. And so, what I do is I literally sit on my leg oftentimes to keep people from seeing my legs shake. Or I have pockets and I keep my hands in my pockets, or as you can see, oftentimes I'm talking with my hands. The person can also be very irritable, problems with sleep. Now, that is how depression and anxiety kind of mirror each other, where they both can disturb the person's sleep. A person with depression can either have hypersomnia, they sleep a whole lot, or they can have insomnia and they can't sleep at all. They may fall asleep but can't stay to sleep. With a person with anxiety, they have insomnia. They usually describe racing thoughts at night, not being able to stay up, or what have you. And then there's a lot of muscle tension. When I get anxiety, people will see me doing this a lot because there's tension in my neck. And there's other somatic symptoms that can come up, such as like butterfly feeling in your stomach. I've had patients to get very nauseous. And then also you could have panic attacks associated with anxiety as well. And so essentially what I just wanted to share with you guys is just the difference between how depression can manifest itself as opposed to anxiety, how they can kind of somewhat overlap. One, they're both similar because they're both mood disorder. It affects a person's mood, but it can also manifest itself somatically in a physical way, but it's related to their emotional health. And so, in either case, it's also important to know that depression and anxiety can be comorbid. That means that they can exist at the same time. I'm living proof of that. I have both major depression and generalized anxiety. And so, a person with depression may tend to isolate themselves during a depressive episode, just like a person with anxiety may isolate themselves. A person may isolate themselves because they become anxious in social situations, and that isolation can contribute to them being depressed because they feel alone. Or the person can be depressed and isolate themselves because they just don't have the same interest that they normally would have at that particular time. So share this with a friend. If you have any questions about depression or anxiety, please post it in the links in the comments. And yay, seasonal affective disorder season is soon about to go away. But I hope the information that I'm sharing with you guys has been helpful. Go and crush the rest of your Monday.